Now, President Obama just wrapped up a meeting with a bipartisan group of governors on one of his top priorities, and that is health care reform. Bloomberg's Peter Cook is at the White House with Governor Jennifer Granholm from Michigan. Peter?
Thanks very much, Matt. We are here at the White House with Governor Granholm. We just wrapped up a meeting with the president talking about health care. Thank you very much for the time. I appreciate it. And what was your message to the president? What is riding on this debate here in Washington, back in your home state?
Well, I can tell you, we are the poster child state for if you do nothing, what happens, especially to the business community and to individuals. Our General Motors and Chrysler bankruptcies, much of that is because we have an uncompetitive health care system for the business community. And, of course, those who are affected are worried about losing their health care, and certainly we've got a huge number of uninsured. So what we are pressing the president on is on economics. We need a uniquely American solution. We need there to be affordable, accessible health care for all. That affordable part has got to be a key component of it. So that's what we spent time talking about in a bipartisan fashion with
bipartisan fashion. There were Republican governors there as well. Uniquely American solution. There are some out in the business community, and obviously some Republicans as well, who say this idea of a government option is not uniquely American. It's uncompetitive to have the government weigh in the insurance marketplace. It will kill the private insurance business. Your reaction?
I mean, what's Medicaid? What's Medicare? In Michigan, Medicaid is run by the private sector. I mean, it is a public program, but it's run in partnership with the private sector. The bottom line is we have systems right now that do this. It's just an option. The point is that the president made and that we made is we want people to be able to keep the choices that they currently have. But the current system as it now works is perverse. You pay people for providing more service whether it works or not. And so you need to make sure that we reform health care, bring down the costs, use health care information technology to make it streamlined and provide it to everyone. And that would be a good system for the U.S. and for business, too.
Did you tell the president that he should stick to his guns, hold to having a public option here? Because there are Democrats talking about co-ops, other alternatives.
Right. In this meeting, we didn't really spend much time on the public option because the bipartisan group of governors, we have 6 points that we all agree on. We didn't focus on the ones that we disagree on, so we focused on the things that we knew that could be included in the bill. But I can tell you personally, I think that having a public option is important. It does sort of level the playing field, make the private sector honest, gives people a choice. It doesn't force them into it. And again, making sure that choice is there is critical.
All right, let me ask you while I have you. We've focused so much on the auto sector. You talked about the relationship between this issue and the auto sector. What's going on with GM and Chrysler. Can I get your sense right now about what's going on with the suppliers in your state, the ripple effects from GM and Chrysler? And did you talk to the president, have any opportunity to speak with him today about potentially more federal help for suppliers?
We didn't talk about suppliers with the president, but we have been in constant communication with the auto task force about suppliers. This ripple effect, it's, people think it's just General Motors or just Chrysler. There are 16,000 automotive suppliers across the country that are impacted when General Motors and Chrysler hibernate, much less shut down their factories. It is a major issue. Michigan has a 14.1% unemployment rate. Much of that is due to the supplier sector that really has nowhere else to turn.
Is the task force helping you?
Yes, the task force is helping the Tier 1 suppliers, and we're working with them on a solution to provide access to capital for those suppliers who are down the chain.
All right, well, I got you fine. I need to ask you about the other big story this afternoon. Governor Sanford, someone you know well from your time as a governor. He's served as head of the Republican Governors Association, stepping down from that position. Your reaction to the news about what's transpired there, and should he step down as governor?
Well, Governor, I don't know. My reaction is really about his wife and kids. I mean, they are friends of ours, and I'm just, I'm floored by this. I would never, if I were betting, I'd be the first person in the pool to say that's not him. This is really, I'm just really shocked by it, and my heart goes out to Jenny and the kids, and I hope people can at least give them their privacy. What is with you men?
I'm going to leave that one untouched right there. Governor Granholm, we appreciate you taking time out to talk with us here at the White House. Governor Jennifer Granholm of Michigan here at the White House meeting with President Obama to talk health care, and we'll send it back to you, Matt, in the studio.
Holding her position as my favorite governor, regardless of what state she's from.